So FE is extrovert feeling, making people feel encouraged and happy.
Right. And I actually, one of the things that, I said openly recently is that I like people and I like people to be happy around me. You know what I mean? So there was a patient, I think she was like maybe like in her early 30s. And I think she was pregnant with her first child. And she had like a stretch mark was like on another level. It was a lot. And it was very like, it was just a lot. And and you can tell that she was self-conscious about it. And when the doctor kind of like, when she opened up her belly and we're doing the to listen for the fetal heart rate and stuff, she was just like, looking at her belly, and and the doctor was like, yeah, it's a lot of stretch mark. And she was like, yes, and she was feeling somehow about it. So after the doctor left, I just went back in. And so I told her, I was like, it's a badge of honor, you know. And she looked at me and she smiled, and I was like, oh, and I was like, I have it too, I have kids. I said, it's a badge of honor because it's her first. So I'm sure she was just like, my entire body is messed up, so I just wanted, and the reason I did that is because I wanted to encourage her and for her to understand that this is normal. It happens to a lot of females, and it doesn't like it doesn't like make you look less attractive. It's actually a badge of honor, and not to take away from anybody or insult anyone, but the truth is there's some people that really would like to be pregnant, right? But they just didn't have that opportunity. So, and that's why I said it's a badge of honor that you actually went through this, and and this is something that you can, I guess, use to show for it as a badge of honor.
Yeah.
And obviously the people that can have children too, they have their own badge of honor, you know what I mean, that they will be able to show. But this is yours, so hone it and don't feel bad about it.
Introvert sensing is about familiarizing yourself with the same information, the same facts, the same details. So recite 3 different ways to treat preeclampsia.
Okay, so you want to reduce the temperature, the blood pressure. So pregnant women, so probably labetalol or something. And then definitely give magnesium, so to prevent seizure. And depending on how far along they are, I might decide to deliver. But if they are still like early in the pregnancy, and then see what is happening with their blood pressure, then so just basically giving them some beta blocker.
Beta blocker, magnesium, and then just monitor.
Yeah,
monitor them routinely.
Yeah, and then definitely monitor the fetal.
The fetal, yeah. Mm-hmm. Awesome. A patient is complaining of increased urination. Based on evidence of just that, what are all the differential diagnoses you can come up with?
Increased urination. So
just by knowing the patient has increased urination, what are all the possible diagnoses you can explore?
Number one on the list is diabetic. Are they diabetic? And then I can start to think if they have any kidney issues, like so. Well, actually, maybe some central nervous system issues. So maybe so I would think of nephrogenic, right?
Nephrogenic diabetes insipidus.
insipidus, yeah. And then
Central versus nephrogenic, yeah.
yeah.
Diabetes.
Yeah. So central versus nervous. So central nervous system. So looking at both of them to see which one. And I know, like, of course, you have to do test for that to see which one is which. So what else? Then it could also be psychological, like, drinking. Maybe they're actually drinking too much water. So mention psych, mention kidney, and mention central nervous system. What else? So someone that's peeing a lot. What else can I think about?
There could be some kind of urinary tract infection, UTIs, having an overactive bladder or a vesicovaginal fistula.
Oh, okay, yeah. Okay, yeah. So that means there's no control on it, so it's just coming out by itself.
Yeah.
Right.
They would have to specify, though, it's happening like all the time, all day, kind of, though, not just urge to urinate.
To pee, yeah. So
if it's a male, you can also have BPH as one of the differentials.
I mean, we can just keep going if we don't have any.
This is the thing with extrovert intuition. You can go through all the possible things.
If there's no age limit and there's no description, we can just keep going. It could, like, literally be anything.
Extrovert intuition is taking one fact and then
it could be a mass. It could be some type of mass. It could actually, like, it could be, I can even go crazy and say maybe it could be some type of aneurysm that is present on the bladder, male smoker,
any kind of obstruction.
Yeah. So I've always just have, like, this interest in maternal and fetal health, and so just learning more about the female body and how things operate and how things work, and even looking at, like, we were on rotation, the OB rotation, even seeing that the difference in the anatomy of, like everyone is just different, that in itself is, like, I mean, it sounds weird, but it is kind of exciting for me to know that everyone is different, everyone is unique. In that, I guess that presentation, I guess. So basically just learning more about women's health and babies, I guess, fetal,
You're definitely right about how everyone's different. Like, it's easy to think of medicine as just this field where there's all these standards, and it's just, okay, go by the standards and that's it, problem solved. But no, everyone is different. It's a lot more complex than that. Like, everyone's got their own individual way of handling things, responding to different drugs and stuff. It's not as clear cut as
and I think also, like, I guess that's what I love about rotations and having the opportunity to see patients and stuff, because, for example, there's some things that, like, you will think that are abnormal just because you only know the textbook morphology, like, okay, according to the textbook, this is how this is supposed to look, and then because you only know the textbook of that, you might think, oh, what is that? Is that abnormal? But it's not. That's just their own, that's just their whole body, and there's nothing abnormal about it. So I guess more, what I think, what I enjoy most about being a medical student, it's learning what is normal. Like, it's actually understanding what is normal, so that's when
what is normal, what is healthy, what are you define health.
Yes. I think that because then when you see enough of what is normal, it's very easy for you to pick up what is abnormal, right?
Yeah, exactly.